Good day, my name is Sister Mbali and I'm a professional nurse and midwife. Today we'll be speaking about what to expect at your first antenatal appointment. This appointment is probably going to be the most nerve-wracking one because you don't know this healthcare professional, and I know how nerve-wracking these healthcare facilities are because now you're going to be assessed. Okay, there is a full body assessment that is done where the nurse will check from head to toe. So if you go to the private sector, you'll be seen to by either a midwife or gynecologist, depending on what type of care that you would need for your pregnancy. So they will need you to take off all your clothes, and they will do assessment, checking eyes, ears, nose, if there's any obstructions in the mouth, because oral care also does affect the pregnancy, if there's any lumps or growths, or even just the shape of your nipple, so we can prepare for breastfeeding. If your nipple has to be inverted, then there are things that we can do to prepare you and the baby when it's time to breastfeed. They also assess your abdomen. If you've had any surgeries, it would be so important to speak about that. Then they'll also assess in your genital area if there's any obstructions that could make it difficult for the baby to come out, or if there's any, for example, lesions like STIs. So the nurse or the midwife or the doctor will be able to treat those, as well as your legs. If you have things like varicose veins or swelling of your feet, it's very important to address those, especially if it's still in the very early stages, because it could mean that there's an underlying condition that you were not aware of. So in the private sector, if you're seen to by a midwife, midwives do generally operate the same whether it's in the government sector or the private sector. But with the doctor, it's also quite different. Doctors are also able to do scans. Some midwives are able to do scans, but they're not allowed to do any diagnostic scans. You'd just be able to see that the baby's inside the womb. But with the doctor, they'll be able to then measure a few things to see if there's any conditions such as Down syndrome, if the baby is growing well, also being able to see the heart and assess the heart. Other investigations that will be done will be baseline investigations. So they will do a blood pressure, they will do a pulse, we'll do a weight, your height. We will do antenatal screening bloods, which include HIV. If you are already positive, it's okay to tell the sister or the midwife or doctor what treatment you're on and when you started treatment. Then a viral load will be done, and that will be repeated every 12 weeks throughout your pregnancy. But if you're HIV negative, it's important to do an HIV test at every single appointment. You will not be forced to do one because you also have a right to not want to do an HIV test, but it is advised that you still do an HIV test at every single visit. Then we also test in the antenatal screening bloods, we also test other bacteria such as syphilis. We also check for measles, because that can still go through the placenta and affect the baby. We also do a urine test to just check a baseline, because there's so much we can learn from your urine. If there's already blood in your urine, especially in the early phases, then it means that you could be at risk for miscarriage. If there's ketones, it means you haven't eaten. Protein could mean that your heart is not okay, or your blood pressure is starting to go high. So the urine is such an important test, and I know it's not very comfortable, but still try to partake in the test that the sisters or the doctor are recommending to you. And after doing the full body assessment and the blood works in the urine, you will then have a sit down with your healthcare provider, and they will ask you a few personal questions and try to be as honest as possible. They will ask you how many pregnancies you've had before, if you've had anything miscarriage or even a termination. It's very important to tell us. We will also ask you a family history, especially from your mother, your father's side, as well as your siblings. If there's any genetic conditions or high blood pressures or diabetes or any medical conditions that anyone has in your family, it's very important to know. If you've had previous surgeries as well, it's very important for us to know. Another question that we will ask is if you are able to do a blood transfusion, because in some cultures and religions it's forbidden. So it's important that you just find out from your family what it is that would be practiced in your culture. Make sure that even with the placenta as well. I do know that in the private sector, not all facilities give the placenta for you to go home, but they will ask you what you would like to do with it. You can either keep it at the hospital or you can take it home, but you'd need an affidavit for it. Another thing that we would ask you is if you're taking any substances, because it's very important to know what substance that you're taking, either whether it's medication or if you're taking drugs or alcohol. It's important for us to know so that at least we can take care of the pregnancy according to those needs. And also try to wean you off some medications, some psych medications, or alcohol you shouldn't even be taking at all, or smoking, but I know it's very difficult to stop. So we will try wean you off, especially so that you, by the time your pregnancy ends, that you've cut out, or if you're able to cut out, then that would be great.